Intestinal microbiota represents all the microorganisms that live in our digestive tract: bacteria, fungi, archaea, viruses, also bacteria's viruses. And all these microorganisms live in perfect harmony with our cells. It is classic to say that when we are stressed, we are going to have a stomachache. We all know that when we have an exam, we are a bit stressed. We can have cramps, we can have diarrhea, and this is what we call brainocentrism. Everything starts from the brain and affects the digestive tract. But in reality, we know now that it's much more complicated than that. When we are not well, we have a stomachache, and that can impact the brain, bottom up, and increase the level of stress, the level of anxiety, which means that we are in a bilateral dialogue where when the stomach isn't well, head won't be well, and when the head isn't well, stomach won't feel well either. The brain will act on the gastrointestinal tract by several pathways. There can be the neurotransmitter pathway, for example, GABA. GABA is a compound that allows neurons to communicate with each other. And the particularity of GABA is that it is an inhibitor, i.e., when one has high levels of GABA, transmissions are inhibited and one is less stressed. There are other ways too. There is the vagus nerve, for example, which makes the brain and the digestive tract interact in both directions. And so, depending on the activation of the vagus nerve, we are more or less stressed. The digestive tract contracts in a different way. There are also hormonal pathways. For example, when we are stressed, the hypothalamic pituitary adrenal axis will lead to the production of cortisol, which will also modify the digestive tract. Conversely, the digestive tract will act on the brain in several pathways. We can have, for example, an increase in intestinal permeability. In this case, bacterial compounds will pass from the digestive tract into the bloodstream. First the portal vein, then the liver, then the entire tract, and the entire bloodstream, particularly the brain, causing inflammation and stress. The Occidental diet, which we can call junk food, too rich in sugar, too rich in fat, will modify our bacteria, leading to a loss of bacterial diversity, and possibly leading to a higher level of anxiety and stress. Therefore, to decrease your anxiety level, one method would be to modify your diet. One cuts down on sugars, cuts down on starchy foods, on fat, and enriches one's diet with fibers. Another solution is to give what we call prebiotics, i.e., food for our own bacteria, to our digestive tract, and by giving prebiotics, we will encourage the growth of good bacteria, which will have a beneficial effect on stress. Another solution can be to give probiotics, i.e., living beings, bacteria or fungi, which can have a beneficial effect on our health. Depending on the properties of these bacteria, we can modify the metabolites that are produced, and by this mechanism, reduce the level of stress and anxiety. If you want to act on the brain, there are simple methods. For example, by modifying the activity of the vagus nerve, by doing cardiac coherence exercises, or by doing sophrology exercises. And so by using simple, natural methods that you can do on your own, you can reduce your level of anxiety and stress.